So the procedure itself is done to seal off a part of the heart called the appendage where clots normally form. When clots form in that area, they can cause a stroke. So most patients who have atrial fibrillation have a high risk of having a stroke. The atrium does not move very well, therefore clots form when the blood pools. So mostly, quite often, we prescribe blood thinners to prevent clots from forming, prevent stroke. But in this particular patient, he had a series of falls due to other illnesses, Parkinson's disease, which made him at high risk to be on a blood thinner. For example, if he falls, then he's at a higher risk of falling, hurting himself, having a bleed anywhere in his body and his brain. So this procedure is nice because what it does, it offers him the protection of preventing a stroke without being on a blood thinner. So that's the purpose of the procedure, is to basically an alternative to a blood thinner to prevent strokes. One thing about the Watchman, it's very well studied, and there is data to support that it's actually superior to warfarin in terms of preventing stroke, which is the kind of the gold standard for a blood thinner, and obviously it's a much lower risk for bleeding. So what it allows them to do is get off their blood thinner. In terms of recovery, it's an overnight stay. They have a stitch in their leg which is removed before they go home, and they can't drive a car for 2 days and can't lift more than 10 pounds for a week. But that's mainly for the leg to heal. There's no other restrictions. In terms of the Heart Vascular Institute, the one thing nice about what we do in Cedar Rapids, specifically the Heart Vascular Institute, is that there's no procedure where you'd have to travel outside Cedar Rapids for. Okay. That wire?
Yep. Watchman sheath is going in.
One month, 45 days roughly, where we have them on still high-dose blood thinners. After the 45 days, we'll go to a lower dose of a blood thinner for 6 months, and then after 6 months, then we'll go to just an aspirin.
It was effortless. He came in and said hi and just told me that everything went well and it looked good and shouldn't have to mess with it at all. And it's just, that's unbelievable. But it's great, the technology and the people that run them do a great job. In St. Louis in particular, I'd recommend it to anybody that I know.